Hi y'all, I'm Morgan, and lastly I'm going to talk about our nursing care plan. So I'm sure you've all learned about ADPI in nursing school, so let's get our ADPI on. First, assessment. What would a nurse uncover while assessing a hepatitis patient? Let's start with some subjective data. So first, use of any type of medication, so possible misuse of Tylenol, over-the-counter meds, or any type of supplementations that the patient is currently taking. Also, exposure to infected person. This does include healthcare workers, also any travel recently, or if the patient lives in an overcrowded, unsanitary environment. Also, IV drug and alcohol use is important. Sexual behaviors, weight loss, fullness in upper right quadrant, fatigue, anorexia, pruritus, and nausea and vomiting, of course. So now some objective data that the nurse may find. Increased ALT and AST levels, increased serum bilirubin, hypoalbuminemia, say that 3 times fast, anemia, low-grade fever, rash, jaundice, splenomegaly, as well as hepatomegaly, and a positive test for hepatitis, so such as the blood tests. And now let's talk about some diagnoses. There could be several that fit hepatitis patients. First, acute pain related to edema of liver and bile irritating skin, or risk for impaired liver function related to viral infection. I went with imbalanced nutrition, less than body requirements related to anorexia and or nausea. And this is as evidenced by weight loss and vomiting. We're going to go over 2 goals for this diagnosis because I felt like it could fit acute or even chronic hepatitis. So goal number 1, patient will understand and recognize nutritional requirement needed by the end of shift. So some interventions a nurse can implement to reach this goal would be provide dietary teaching on consuming a well-balanced diet that the patient can tolerate. This is really important. Keywords patient can tolerate. So snacks or anything that's nutritious that doesn't make the patient even more nauseous or want to vomit. So another intervention would be discuss patient's favorite foods or preferences in order to incorporate high protein and high calorie foods into the daily diet. It's important to see what the patient really likes so we can incorporate that instead of just giving them a long list of stuff they have to eat. They probably won't eat it, especially if they don't like it. Also, lastly, get a dietitian involved. Definitely important, utilize your resources and speak with a dietitian, have them come and consult your patient.